Dr. Lilangri is a French doctor who's written a whole book on salt. It's called The Secret of the Sea, something like that. And he says, when I get a patient with high blood pressure, I immediately put them on Celtic salt because it'll bring the balance back.
As we age, keeping our arteries healthy becomes more challenging, but with the right steps, diet tweaks, hydration, gentle exercise, and key herbs, you can significantly reduce your risk of heart disease and stroke. This information is for educational purposes and not medical advice. Consult a healthcare professional before making any changes to your diet, exercise or supplement routine. Results may vary. But before we start, drop in the comments from where you are watching this video and what topic you'd like to see in the next video. 1. What damages your arteries? Arteries are lined by delicate endothelial cells. When these cells get injured, plaque forms and stiffens arteries, raising blood pressure. Common causes of endothelial damage include 1. Environmental toxins. Cigarette smoke. Thousands of chemicals directly hurt artery walls. Household chemicals, detergents, pesticides, processed food additives, and even off-gassing from clothing release toxins that injure endothelial cells. 2. Heavy metals and mycotoxins. Mercury, found in some fish and dental fillings. This neurotoxin also harms blood vessels. Mold toxins. Water-damaged homes expose you to mycotoxins that damage endothelial lining. When endothelial cells are injured, LDL cholesterol patches the damage, much like fire trucks at a fire. Over time, repeated patching forms atherosclerotic plaque. Cholesterol is simply responding to injury. It is not the root cause. Comment protect arteries if you'll focus on avoiding toxins this week. 2. Blood sugar and sticky proteins. Another major contributor to plaque buildup is glycation, when excess blood sugar binds to proteins, forming sticky glycoproteins. These glycoproteins cling to any injured spot on your arteries, accelerating plaque formation. To prevent this, minimize added sugars. Keep daily added sugar under 25 grams, 6 teaspoons. Choose whole fruits, berries, apples, oranges. Fibre slows sugar absorption. Pair carbs with protein/fat. Combining carbohydrate sources with protein or healthy fats prevents sharp blood sugar spikes. When blood sugar stays stable, fewer sticky proteins form, which helps your arteries remain cleaner and more flexible. Type sweet balance if you're swapping sugary snacks for fresh fruit. 3. Cholesterol, clearing up the confusion. Many believe that high cholesterol itself causes heart disease. In reality, cholesterol is essential for cell membranes, hormones, and vitamin D production. Here's the truth. Cholesterol is a repair agent. When arterial walls are damaged, cholesterol helps rebuild them. Think of it like seeing fire trucks at a fire. They fix the problem rather than cause it. Statin caution. Statins can cause muscle aches, memory issues, and increased diabetes risk. Many patients stop statins due to side effects, and their cholesterol rebounds. Better focus. Inflammation and endothelial health. Reduce toxins, balance blood sugar, and eat anti-inflammatory foods. HDL and triglycerides. Aim to boost HDL, good cholesterol, and lower triglycerides through diet and exercise. Common cholesterol clarity if you'll prioritise inflammation control over just lowering LDL numbers. 4. Hydration and sea salt. Proper hydration is one of the simplest yet most effective ways to support healthy blood pressure. Blood viscosity dehydration thickens blood, making the heart work harder. Adequate hydration slightly thins the blood, improving circulation and reducing arterial strain. Sea salt's role, unrefined sea salt, Celtic, contains 80 plus trace minerals, magnesium, potassium, calcium, that help maintain cellular fluid balance, unlike table salt, which is stripped down to nearly pure sodium chloride. Daily hydration plan 1. 8-ounce glasses of water, at least 64 ounces daily, spread throughout the day. 2. Add sea salt, a sesame seed-sized pinch in each glass. This replenishes trace minerals lost through sweat and urine. 3. Steady sips. Sip water throughout the day rather than chugging it all at once. Combining hydration with trace minerals optimizes your body's sodium-potassium pumps, preventing cells from swelling and arteries from stiffening. Comment "hydrate right" if you'll add sea salt to your water today. 5. Salt and mineral balance. Labelling all salt as bad oversimplifies matters. It's the type of salt and overall mineral balance that counts. Refined table salt, stripped of trace minerals, leaving nearly pure sodium chloride. Excess sodium causes cells to pull in water, increasing blood volume and pressure. Unrefined Celtic sea salt, harvested by hand, retaining dozens of minerals exactly as in seawater. When minerals matter, sodium-potassium pumps. These pumps regulate fluid inside versus outside each cell. High sodium from table salt plus low potassium from few fruit/vegetables, water, floods into cells, increased vascular pressure. Potassium, rich foods, bananas, sweet potatoes, spinach, beans, and help your body flush excess sodium and lower pressure. Practical tips. 1. Replace refined table salt with Celtic sea salt. 2. Add a pinch of sea salt to each glass of water, 8 times daily. 3. Eat 4 to 5 servings of potassium-rich vegetables/fruit daily. Comment "salty balance" if you'll switch to Celtic sea salt today. 6. Whole food diet and daily movement. Managing blood pressure long-term means focusing on whole foods, regular movement and stress reduction. A. Whole food, plant-focused diet 1. Vegetables and fruits. Aim for 5 to 7 servings daily. Examples: kale, spinach, broccoli, berries, citrus fruits. These deliver fibre, antioxidants and potassium. 2. Whole grains and legumes. Brown rice, quinoa, oats, lentils. Beans packed with fibre, B vitamins and trace minerals. Fibre helps regulate blood sugar and cholesterol. 3. Healthy fats. Extra virgin olive oil, avocado oil, walnuts, almonds, chia seeds, flax seeds. These monounsaturated and omega-3 fats reduce inflammation. 4. Lean protein, wild-caught salmon, mackerel, pasture-raised eggs, Greek yogurt, tofu. Balanced intake helps maintain muscle mass without overloading saturated fats. 5. Minimise processed foods. Avoid refined sugars, hydrogenated oils, artificial additives and convenience snacks. These drive inflammation and blood sugar spikes. B. Simple movement and exercise 1. Aerobic activity. 30 minutes of brisk walking, swimming or cycling at least 5 days a week. Improves circulation, lowers inflammation and supports healthy weight. 2. Strength training, 2 sessions per week with light weights or resistance bands. Building lean muscle, especially in legs, quads, hamstrings, glutes, helps regulate blood sugar and raises metabolic rate. 3. Flexibility and balance. Gentle yoga, tai chi or daily stretching improves circulation, reduces stiffness and lowers injury risk. C. Stress management and sleep. 1. Daily meditation or deep breathing 10 to 15 minutes each morning or night to reduce cortisol and calm the cardiovascular system. 2. Consistent sleep. Aim for 7 to 8 hours of quality sleep. Poor sleep elevates blood pressure and inflammation. 3. Mindful breathing. Practice 4-7-8 breathing. Inhale 4, hold 7, exhale 8 whenever you feel stress. Comment heart health if you'll commit to whole foods and daily movement. 7. Powerful herbs. Cayenne and hawthorn, alongside diet and lifestyle, certain herbs can support healthy blood pressure. 2 top choices are cayenne pepper and hawthorn berry. Take cayenne pepper, capsicum 1. Natural blood thinner. Unlike aspirin, which can increase bleeding risk, cayenne gently thins blood without harmful side effects. 2. Vasodilator. Capsaicin relaxes arterial walls, improving blood flow and lowering pressure. 3. Arterial support. Stimulates endothelial repair to strengthen any minor tears. Usage. Start with 1/4 teaspoon of cayenne powder in 1/3 cup water before meals, 3 times daily. A mild tingling is normal and subsides quickly. Increase to 1/2 teaspoon if well tolerated. Comment spicy saviour if you'll try a cayenne shot before your next meal. The hawthorn berry. 1. Adaptive heart tonic. Lowers high blood pressure and raises low blood pressure, guiding levels toward normal. 2. Cardiac strength and rhythm. Improves heart muscle function, helps correct arrhythmias, and enhances coronary artery flow. 3. Antioxidant protection. Rich in flavonoids that reduce oxidative damage in arterial walls. Usage. Options. Tea. Simmer 2 teaspoons of dried hawthorn berries in 1 cup water for 10 minutes. Strain and drink 3 to 4 cups a day, about 1 litre total. Capsules/tablets. Up to 4,000 milligrams of standardised extract daily. Follow label instructions. Tincture. 1 to 2 teaspoons in water 2 to 3 times daily. Comment half tonic if you're adding hawthorn berry today. 8. Your daily action plan. 1. Morning. Hydrate 8 to 12 ounce water plus pinch of Celtic sea salt. Protein rich breakfast. 20 to 30 g protein, eggs, Greek yogurt or a protein shake. Cayenne shot. 1/4 to 1/2 teaspoon in water. 2. Midday whole food lunch, salad with leafy greens, vegetables, beans or fish, and olive oil. Movement break, 5 to 10 minutes of brisk walking or gentle stretching. Hawthorn tea, sip 1 cup or take a capsule. 3. Evening wholesome dinner, roasted vegetables, whole grains or quinoa, and healthy fats, avocado, nuts. Stress relief, 10 minutes of meditation or deep breathing. Hawthorn capsule. Final dose of the day. 4. Daily habits. Ditch processed foods and refined sugars. Avoid cigarette smoke, harsh chemicals and excess alcohol. Move for 30 minutes at least 4 to 5 times a week. Practice mindful breathing during tense moments. Comment action plan. If you're ready to follow this plan, high blood pressure doesn't have to control your life. By protecting your arteries, stabilising blood sugar, hydrating with sea salt, eating whole foods, moving regularly, managing stress, and using cayenne and hawthorn, you can transform your cardiovascular health. Start these steps today and see your numbers and your energy improve. Comment healthy arteries if you're committed to managing blood pressure naturally. And remember to like, subscribe and share for more health tips.